Topic: Physiological responses of the newborn to birth. For the newborn nursing, for the basic nursing, Kamal Seal, nursing instructor, RN, RMRP, and MNSC, Dhaka Nursing College, Dhaka. Learning objects and the end of the lessons, students will be able to describe the physiological changes at birth, explain the importance of newborn at birth adaptation, describe the physiological responses and adoption of the newborn to birth. Physiological responses of the newborn to birth concepts. The newborn's physiologic capacity to make the transition to extraterrestrial life. First week of life is the most crucial of a newborn when transition from fetus to neonate is the greatest hazard to overcome. The healthcare providers can tell assess and respond appropriately in the event of problems. Physiological changes at birth. Loss of umbilical circulation to placenta, closure of ductus venosus, closure of the foramen ovale, closure of ductus arteriosus, large increase in pulmonary circulation, increase in renal blood flow from decreased renal vascular resistance, changes in skin blood flow. The importance of newborn at birth adaptation. First week of life is the most important of a newborn because adjustment a new environment are necessary for continue of life within the next few days and weeks. When transition from fetus to neonate is the greatest hazard overcome such as respiratory system, circulatory system, digestive system, and immune system are changes, and also warmth and shelter of the uterus are changes. This includes establishment of respiration, cardiovascular adaptations, hematologic adaptations, hepatic adaptations, temperature gastrointestinal adaptations, urinary adaptations, and immunologic adaptations, neurologic adaptations. Respiratory adaptation. Initial respirations are started by physical, sensory, and chemical factors. Physical factors include the effort required to expand the lungs and fill the collapsed alveoli, e.g., change the pressure gradients. Sensory factors include temperature, light, noise, and sound. Chemical factors change in the blood, e.g., decreased O2 level, increased CO2 level, and decreased pH level. As a result of the transitory asphyxia during delivery, the newborn respiratory rate ranges between 30 to 60 breaths per minute. Oral mucosa secretions may cause the newborn to cough and crack, especially during the first 12 hours. Physiology of respiration, trachea, lung. বোঝা যায় না কেন? Spontaneous breathing, the driving force needed to overcome the elastic airflow, resistive and inertial properties of the respiratory system is the result of the intrapleural pressure changes generated by the respiratory muscles. Cardiovascular adaptation. Various anatomic changes take place after birth. Some are immediate and others occur with time, e.g., umbilicus vein, umbilicus artery, lungs. Peripheral circulation is sluggish, causing cyanosis of the hand, feet, and around the mouth. Pulse rate 120 to 160 beats per minute while awake and 100 beats per minute while, while asleep. Blood pressure averages 80 by 46 mmHg and varies with the size of the newborn and newborn activity level. Normal newborn hematologic values SB 15 to 20 G by DL, RBC 5.0 to 7.5 million mmQ, WBC 10,000 to 30,000 mmQ, platelets 1 lakh to 2 lakh 80,000 mmQ, blood circulation, superior vena cava, pulmonary valve, tricuspid valve, inferior vena cava, right ventricle, left ventricle, aortic valve, mitral valve, left atrium, pulmonary artery, pulmonary vein, aorta, blood circulation. This is very urgent in the superior vena cava of Bangladesh in the shit. Fetal circulation, ductus arteriosus, aorta, foramen ovale, lung, pulmonary artery, ductus venosus, liver, left kidney, lung, umbilical cord, umbilical vein, umbilical arteries, oxygen placenta, oxygen rich blood, oxygen poor blood, mixed blood, fetal circulation. Thermoregulation and metabolic changes. The newborn's temperature may drop several degrees after delivery because the external environment are cooler than the intrauterine environment. A limited supply, subcutaneous fat, and a large skin surface area in relation to body weight predispose the newborn to heat transfer with the environment. Rapid the heat loss in a cool environment occurs by conduction, convection, radiation, and evaporation. Cold stress hypothermia in the newborn with its associated metabolic acidosis can be lethal even for a vigorous full-term newborn. Neurologic adaptation. The newborn's neurologic system is not fully developed anatomically or physiologically. Neonatal development is rapid as the newborn grows. More complex patterns of behavior, e.g., head control, smiling, and purposeful breathing. Newborn reflexes are important indicators of normal development, e.g., newborn reflexes rooting and sucking, swallowing, marrow, stepping, etc. Gastrointestinal adaptation. Digestive enzymes are active at birth and can support extra uterine life by 36 to 30 weeks gestation. The necessary muscular and reflex developments for transporting are present at birth. Digestion, protein, and carbohydrates is readily accomplished. Fat digestion and absorption are poor due to inadequacy of pancreatic enzymes and leprosy. Continues. Salivary glands are immature at birth. Little saliva is manufactured until the newborn is 3 months old. Meconium boil movement, which is greenish black vesicles and contains occult blood, is excreted within 24 hours in 19% of normal newborn. Random hand-to-mouth movement and finger sucking have been observed in utero. These actions are well developed at birth and are intensified with hunger. Kidney adaptation. The glomerular filtration rate is relatively low at birth owing to inadequate surface area of the glomerular capillary.
আচ্ছা আচ্ছা আমি ধরতেছি না তুমি হাঁটো।
Although these limitations don't compromise the healthy newborn, they do restrict the capacity of the newborn to respond to stressors. Decreased ability to excrete drugs and excessive fluid loss can rapidly lead fluid imbalance. Most newborn void in the first 24 hours after birth and 2 to 6 times per day for the first 1 to 2 days. Therefore, the void 5 to 20 times in 24 hours. Hepatic adaptation during fetal life and to some degree after birth, the liver continues to aid in blood formation. During the neonatal period, the liver produces substances that are essential for blood coagulation. Iron stores from the mother are sufficient to carry the newborn few months of extrauterine life. At this time, the newborn becomes susceptible to iron deficiency. The liver also controls amount circulating unconjugated bilirubin, a pigment resulting from the hemoglobin and released breakdown of red blood cells. Unconjugated bilirubin can leave the vascular system, permeate other extravascular tissues, resulting in a yellow coloring term jaundice. Skin, sclera, and mucous membranes continue. The liver also controls the amount circulating unconjugated bilirubin, a pigment resulting from the hemoglobin and released breakdown of red blood cells. Unconjugated bilirubin can leave the vascular system, permeate of other extravascular tissues, resulting in a yellow coloring term jaundice, skin sclera, and mucous membranes. The liver also controls the amount circulating unconjugated bilirubin, a pigment resulting from the hemoglobin and released breakdown of red blood cells. Unconjugated bilirubin can leave the vascular system, permeate other extravascular tissues, resulting in a yellow coloring from jaundice, skin, sclera, and mucous membranes. Immune system adaptation. The immune of a number of protective systems significantly increases the risk of infection in the newborn period. The inflammatory response is reduced qualitatively and quantitatively. Phagocytosis is slow moving. The acidity of the stomach and production of the pepsin and trypsin are not fully developed until 3 to 4 weeks of age. Immunoglobulin IgA is missing from the respiratory and urinary tracts unless the newborn is breastfed. IgA is absent from the GI tract as well. Infection represents a leading cause of morbidity and mortality during the neonatal period.